All right, MLB news. Let's quickly talk about Suzuki Hero. That kid is simply amazing. Even with his performance as of late, he is a guy I want on my mound in Game 7s. All right, let me pull up some stats from the season. He has an average of 6.64 hits per game, 1.33 ERA, and 5 perfect games. He is the player that I want on my mound. Let me say this. He is the Tom Brady of the MLB right now.
Yeah, I agree. And how old is he? Like 20 years old, and he throws like consistently upwards of 100 miles per hour and up to 20 strikeouts in a 9-inning game. But I gotta say, man, I don't know about his performance lately. There are rumors that he's been experiencing some shoulder pain, and he's even had to see a sports medicine doctor. All in all, though, I just hope that the doctor can figure out why his performance has been declining, because he showed us so much potential. And stay tuned for NBA news after the break.
What physical tests should be done to determine whether or not he is experiencing shoulder impingement? If diagnosed with shoulder impingement, what are some possible treatments for him to undergo?
Hello, Mr. Suzuki. My name is Dr. House.
Hello.
How can I help you today?
So lately it's just been, not lately, but like it's been ongoing. My right shoulder's been in pain, especially like after the games, it starts to really act up.
Okay, does it feel tender?
Yeah, so especially like when I'm doing like overhead
Okay.
in the gym, or like when I'm just trying to pitch, or like some
Sure.
overthrowing here,
Okay.
it just really hurts.
Sounds good. I'm just gonna run some tests and see how's your shoulder doing. Can you lie down for me? Right here. Move down a bit. There you go. That's fine. Okay. Just tell me. Just relax your shoulder.
Yeah.
Just tell me when it hurts. Okay.
Okay.
Does it hurt this way?
I don't think so.
No?
Not that much.
Okay.
Not really.
Let's do that. Tell me when it hurts.
Yeah, slightly.
Does it feel here?
Yeah, slightly.
Okay. Can you stand up for me?
Okay.
So I would just want you to put your hand behind you, then push out for us.
Okay.
And tell me when it hurts.
Actually, when I ever try to bring my arm back, it kind of really hurts already.
Hurts in the same area?
Yeah, so
Okay.
I don't know.
Just gonna do one more test. So have your fingers pointing down.
Yeah.
And then bring it up, and then go wide. And come down.
All right.
Tell me when it hurts.
Yeah.
Hurts?
It,
Okay.
like really hurts. Just when I bring it.
Sure.
Yeah,
Okay. One last test, and we should be good. So just tell me, just relax your arm. Just tell me when it hurts.
Yeah.
Does it hurt now?
No, it's like.
Okay.
I think this one was worse.
This one was worse. Okay. Just stay here. I'm gonna come back and tell you what's going on with your shoulder. Okay?
All right. Sounds good.
Tests performed: apprehension test, subscapularis test, Neer's test, and Hawkins test. Of the 4 tests shown, there are only 2 primary physical tests for shoulder impingement: the Neer's test and the Hawkins test. Learning Objective 1. List one thing that occurs in a positive Neer's and Hawkins test. A positive Neer's test is when pain is experienced when lifting the arms up. A positive Hawkins test is when there is pain experienced during the test. Learning Objective 2. Provide 2 examples of conventional treatment and 1 example of surgical treatment. There are 2 treatment options available for shoulder impingement: conventional and surgical treatment. Conventional treatments include specific exercises to improve scapula position and motor control, stretching, local drug injections such as cortisol, K-taping, low-level laser therapy, manual therapy, acupuncture, ultrasound, and massage. According to a systematic review, conventional and surgery outcomes have no significant difference between each other. It is suggested that exercise is combined with other forms of therapy as it has been shown to produce better results than exercise alone. These are some of the exercises done in systematic reviews that have shown to improve results. The role of the exercises prescribed is to work on scapular stability while strengthening the rotator cuff. By strengthening the external rotators such as infraspinatus, we can create more subacromial space and in doing so reduce the extent of tendon impingement. Furthermore, an unstable scapula can lead to shoulder impingement due to insufficient elevation of the acromion during overhead movements. Some of the prescribed exercises strengthen the serratus anterior, which improves the aforementioned conditions. Suzuki Hiro has been performing the conventional exercises throughout playoffs, but he feels that it doesn't seem to work. He wants to continue to play and is willing to look into surgical treatments. There are two types of surgical treatments: open decompression surgery and arthroscopic decompression surgery. Learning Objective 3. Given evidence from systematic reviews, compare the efficacy of the two treatments. The aim of the surgery is to increase the size of the acromial space to reduce the pressure exerted on tendons. To accomplish this, bone spurs that have grown throughout the injury is often removed. Therefore, this surgery is called decompression surgery. Surgery can be either open or arthroscopic. A randomized study found that there was no significant difference between the two methods with regards to clinical outcomes. However, one might choose one method over the other based on personal preference for regards to the invasiveness and aesthetics. For instance, the open surgery can often have more cosmetic issues such as scarring as well as being more invasive. Choose the correct answer before the time runs out. True or false? Outcomes of surgery for shoulder impingement are better than conventional treatments. True or false? Positive results in the Neers test and Hawkins test indicate a potential shoulder impingement. Which of the following is true of shoulder impingement surgery? A. Purpose is to compress the bones and tendons in the shoulder area to prevent dislocation. B. Purpose is to provide more subacromial space. C. It can be done in open and arthroscopic forms. D. Two of the above. To review, there were 3 learning objectives. Number 1, list one thing that occurs in a positive Neers and Hawkins test. Number 2, provide 2 examples of conventional treatment and 1 example of surgical treatment. And number 3, given evidence from systematic reviews, compare the efficacy of the 2 treatments. In a positive Neers test, pain is experienced when lifting the arms up. For a positive Hawkins test, pain is experienced during the test due to movement. There are many conventional treatments as listed here. When choosing conventional treatment, it is best to combine exercise with other forms of therapy as it has been shown to produce better results. There are 2 types of surgical treatments: open decompression surgery and arthroscopic decompression surgery. Studies have found that there is no significant difference between conventional and surgical outcomes. As well, there is no significant difference between the 2 methods of surgery, open decompression and arthroscopic decompression surgery, with regards to clinical outcomes. But one method is often chosen due to personal preference.